Greetings, Kaalaga! My name is Leia, your future nurse. I will now proceed to demonstrate the next health assessment, which is the assessment of the head, face, and neck. I will just shortly introduce the parts of the assessment. First is the head. It is the upper part of the body that composed of scalp and hair, while the face consists of eyes, ears, forehead, chin, cheek, and nose. It is the front of the person's head. Regarding to the neck, it is the part with many vertebrae that connects the head to the torso of the body and provides mobility and movements of the head. Remind you that this is the continuation of the health assessment of the skin, hair, and nails. So, of course, identifying the patient, introducing yourself, explaining the patient the procedure, providing privacy and hand washing was presumably done. Now, let's move forward in obtaining the health history of the patient. Okay, sir, we are already done in your skin, hair, and nails. We will now proceed to the assessment of your head, face, and neck. I will just ask some couple of questions. Is that okay with you?
It's alright.
Is there any problems with your mouth or your face that you are aware of?
No.
Any problems with your thyroid gland?
None.
Okay, then I am going to start the assessment. First, position the client facing on you depending on the client's preference and capability. Instruct the client on what are you going to do. Then, inspect the head and scalp's size and shape. Then, inspect the face. Alright, sir, what do you prefer or comfortable position you want?
I want to sit comfortably.
Okay, sir, please sit down here in this chair. I am now going to check the size and shape of your head and scalp. The size of your head is appropriate to your body and it indicates normal. We call that as a normal cephalic. Your head is round shape, is lined in your body. The right and left of your head is symmetrical, and there is no signs of lumps, bumps, or lesions in the scalp and head upon inspection. I am now inspecting your face, and your face is congruent to your age. It corresponds to your age. I don't see any distorted facial feature or mask-like face. Sir, can you pouch your face for your facial expression just like this? Okay. Can I see your normal expression? Okay. The right and left of your face is symmetrical. Overall, your head, your scalp, and face is normal upon inspection. Take note that having a mask-like face is a motor skill symptoms of a Parkinson's disease. And having an extremely large or too small or an acorn shape of the head may indicate a Paget disease. It is a congenital or developmental disorder. An asymmetrical head or face sometimes is caused by the development and genetics, in which of having a cleft lip or palate and vascular disorders causes asymmetrical head or face, in which if the patient has a genetic health conditions like cleft lip, palate, and vascular disorder causes an asymmetrical features. Another one is having a Bell palsy. It also creates an asymmetrical features. Observe the movement of the head, face, and eyes. Then, palpate the head and scalp. Confirm the skin and tissue integrity. Then, palpate the temporal artery. After that, auscultate the temporal. Then, test the range of motion of the temporomandibular joint. Here, I will now observe your head, face, and eyes. So, please follow my instructions. Now, sir, please do flexion by positioning your head downwards. Okay, extension, positioning your head straight ahead. Then, hyperextension by looking up at the ceiling. Okay, good. Do lateral abduction by moving your head to your right shoulder and vice versa. Now, lateral rotation by twisting your head in motion side to side gently. Sir, now please do again a pouch. Then move your lips in front. Okay, then smile. Okay. Now in your eyes, please look at the left side, center, right side, center, upward, center, then downward, center. Okay, the movement of your head, face, and eyes is normal and there is no sign of abnormalities upon movement. Okay, sir, I will now palpate your head and scalp. Is it okay with you?
Proceed.
Okay. Now I'm going to tell me if you feel pain. Is it hurt?
No.
Here?
No.
Here?
No.
Here? The consistency of your scalp is hard and smooth. It is normal. Negative for any lumps, bumps, lesions, and negative for sensitivity. The skin and tissue integrity are intact. I don't see any swellings, ulcerations, or edema. So now I am going to palpate your temporal artery. Do you feel pain, sir?
No.
Okay. You are negative and having inflammation. Okay, sir, I am now going to auscultate by the use of stethoscope of your temporal. Normal sounds heard. Negative for bruit sounds upon auscultation. Now I am going to test the range of motion of your temporomandibular joint. Please open your mouth. Close. Open. Close. There's a little bit cracking sound and it's normal upon movement. Remember, auscultation is listening for sounds by the use of stethoscope. The abnormal findings in the movement of the head, face, and eyes indicates muscle spasm, arthritis, or neurological disorders. Having a bump, lumps, or lesions can be seen in having cancer or trauma and other conditions. In the palpation of the temporal artery, if there's a pain or the thickening of it indicates inflammation of the artery. Aside from that, if you heard bruit sounds upon auscultation of the temporal artery, it means there is a narrowing blood vessel. In temporomandibular joint, when you heard loud cracking sound, it means there's an inflammation or crepitation. Crepitation means it is a joint problem. Now let's move forward to the neck assessment. First, instruct the client on what are you going to perform. Inspect the neck for skin color, integrity, shape, and symmetry. Then test the range of motion of the neck and observe the carotid arteries and jugular veins. Okay, sir, I will now proceed to your neck assessment. Can see your neck for more inspection. Okay, just like this here. Okay. size of your neck is proportional to your body. The skin color is evenly distributed. The neck is symmetrical in shape, negative for abnormalities. Can you please do again the flexion? Okay. Extension. Hyperextension. Lateral abduction. Then to the other side. The lateral rotation. Gently. Okay. There's no presence of rigidity and a pain upon movement. Okay. Sir, slightly look up because I will check your carotid arteries. Okay. There's no visible pulsation upon inspection. Then I am going to palpate your carotid. There's a visible pulsation upon palpation. On the other side, sir, look up, slightly up. Okay. For jugular veins, please look up to your right shoulder. Slightly. So I'm going to palpate. Please look up to the other side. Okay, while in your jugular vein, it is not distended. On the other side, then it is normal in size. Negative for jugular vein distension. Okay, slightly up. I'm going to palpate. Okay. The trachea is in line and it is movable. It means it's normal. It is smooth and it's normal in size and there is no abnormality upon palpation. In assessing the neck, you can be at the back or at the front of the patient. If there is a difficulty in the movement of the neck, it can be arthritis or other health conditions. In the inspection and palpation of the carotid arteries, remember that it should be one at a time. Because doing it at the same time, the patient might die because of having an occlusion in the blood flow inside. The abnormality in the carotid arteries is called distension or prominence, which indicates vascular disorder. In jugular vein distension indicates on having complications on heart and a condition that affects blood vessels. While in the trachea, there are some cases that it is deviated, indicates of having pneumothorax or fibrosis and other conditions. Now, we are going to inspect the thyroid gland, auscultate the thyroid gland, and then palpate the lymph nodes of the head and neck. Sir, can you please swallow for the inspection of thyroid gland? Negative for enlargement of gland upon inspection. Sir, I am going to auscultate again your thyroid. Okay, normal sound heard and there is no bruit sound. It means it's normal. Sir, I am going to palpate your lymph nodes. First is the periauricular. Next is the postauricular. Third is the occipital. Then the retropharyngeal. And the submaxillary. Sir, can you please look at slightly look at your left side? Okay. Submental. Then to the other side. Submental. Then going to the superficial cervical chain. Okay. The other side, sir. The deep cervical chain. On the other side, sir, look at your right side. And the supra can move freely, the consistency is soft, and it's non-tender. There is no abnormality in the head and neck upon palpation. Take note that the lymph node normal size is 1 centimeter or less than 1 centimeter. If it's greater than 1 centimeter, it is abnormal. Finally, record the collected data to have a legal documentation as the basis of the patient's condition. I hope I clearly demonstrated the assessment of the head, face, and neck. Once again, Kaalaga, your future nurse, Love, Leia. See you and thanks for watching. Bye!